for Medical Services in the Ministry of Health.
Yeah, the DG is here. Please.
So now I think we can hold to confirm as witness. Yes. All right. Okay.
Don't worry, don't worry.
No, Waziri.
Is it possible to pull out that seat?
This one?
Yeah, sure.
Just give me an opportunity. Wait. All right.
They will not give you an opportunity. they want that picture when you're doing it.
When it's at the worst.
Okay, that's enough. I am sure the media will really want to know more about the story going on in Eldoret on the organ trafficking. I want to assure you that I don't want to mix it with the handover and take over. I'll address the media at 2:30 today. I was given by our good Kenyans on social media, but I take it with pride. As I say, bulldozers don't build, they don't destroy buildings, they give way, they clear the debris. So we're here with Dr. Oluga and P.S. Muthoni, and I want to support what P.S. Oluga said. Health is a critical component, just like security, to the citizens of our country. We must bring order to this sector, both public, private. And we'll start it with this afternoon.
Colleagues, that I will be open, I will be transparent, I will be available, and I will be facilitative for you to perform the functions that you have been bestowed by the public service. I come from a background of discipline and commitment. I do not know how to work in a place that do not produce results. And so, sir, I kindly beg for your support.
Thank you.
That we deliver results. Thank you. For the public, I think change has come. Thank you.
I think we are okay. Yes. Congrats, man.
Thank you, Cabinet Secretary Honorable Duale, my colleague PS, Dr. Oluga, the incoming PS, DG, all the senior staff of the Ministry of Health, State Department for Medical Services, and members of the fourth estate. Let me take this opportunity to greet you. Good afternoon. I want just to give, let's introduce ourselves, especially the senior members of the ministry, to know who is actually present as we do this ceremony. I'll start from my right.
Good morning, I'm Dr. Zainab Guruk, the acting CEO for Kenyatta University Teaching and Referral Hospital.
Good morning, good afternoon, sir. Dr. Andrew Mulo, heading the HIV/AIDS program as well.
Good afternoon, sir. I'm Dr. William Sigilai, representing the CEO of Kenyatta National Hospital.
Good afternoon, my name is Dr. Mariciano Ono, representing Dr. Edward Serem from the Division of Reproductive, Maternal, Newborn and Child Health. Good afternoon, sir. My name is Dr. Head of Health Financing.
Good
Afternoon, sound protocols observed. My name is Dr. Martin.
We are done, sir. My name is James Nkabo, Director of Administration.
Good afternoon, CS, outgoing PS, incoming PS, Patrick Amon, Director General for Health.
Thank you. Honorable, allow me as opportunity to hand over to the incoming PS Medical Services. Allow me, sir, to make a few remarks pertaining to the tenure of my stay here as the Principal Secretary of the State Department for Medical Services. I want to take this opportunity to thank the senior rank members of the staff of the medical services. As when I came in, this is the team that I joined, and since that time, sir, this team has been an incredible team. They have supported me during my helm as the Principal Secretary, and I think all the achievements that we can talk about during my period, I want to say that it is a courtesy of this team that enabled me as their leader to steer that. Sir, during my tenure here, I think there are many things that took place, especially the legal reforms that were inevitable for us to start the universal healthcare coverage. I think we are on RRI since I joined this department, in the sense that there were urgent reforms that were required, and I think this team really supported us. I want to talk about the Universal Health Care Act, the Primary Health Care Act, and the Facility Improvement Act, the Digital Health Agency Act, and the Social Health Insurance Act that we all passed together with this team. I think where we have left, as I'm leaving this department, I want to tell you, sir, that my peers, my colleague peers, that so far we are stable in most of those reforms. Two critical institutions were created, sir. Social Health Authority, which is the one that is driving universal healthcare coverage, and the Digital Health Agency. I know the challenges that are there, especially on the Digital Health Agency, in the sense that it's a very new institution, still requires a lot of resources, still requires support in terms of human resource instruments so that it can be operational. I believe that with the incoming and now the incoming peers, whom I want to say that he has also played a part in all those reforms. He was part of the leaders that we relied upon. I think he was at one stage leading some of the committees that were working on those reforms. So my colleague who is coming is not new. I always call him an insider. And we have also benefited, personally I've also benefited from his leadership in terms of, especially during the time of when we were negotiating with the union members. His leadership was invaluable in the sense that he could tell us exactly what needs to be done. And I so believe with that experience that he's bringing here, some of those issues will be resolved within the shortest time possible. I want to say that as I leave this institution, one of the greatest challenges that I can talk about and will be memorable to me is a transition from National Health Insurance to Social Health Insurance Authority. But without this team, sir, it was not going to be possible. People might think that I am the one who did it, but I don't think I am the one who did it. It is this team that really made sure that we worked hard. I remember at one stage, they were asking during the launch of SHA, what is going to happen? Are we going to do the cutting of the ribbon? What are we going to do? Because it seemed like we're just going on. And I told them that on the 1st of October, SHA will be launched. And indeed, SHA was launched. And up to date, SHA is strong. At that particular moment, everybody was wondering, what are we going to do? if we switch off the system, is this other system going to take over? And we assured the public and everybody, together with this team, that SHA will work. And I want to commend the Kenyatta National Hospital team, because that was where we were calling it a command center. We could go there and do all the tests and see if the patients indeed have been served under the new system, and they really did a wonderful job. All the changes that we were making at Kenyatta National Hospital were relayed to all the facilities because we were seeing it live, it was happening there. The other challenges that we faced here was basically the issues of, which I so believe that my colleague is going to take over, is the acting capacity side of, if you hear, everybody's almost in acting capacity. I think we worked on the HR instruments, which are now ready. They have been approved by the public service, and the officers are due for interviews. I so believe that that is an assignment that my colleague will come and conclude, so that the officers are stable in their positions. There are most of our CEOs, I think some of them, their terms came to an end, and that's why we have a lot of acting. So you'll be able to conclude that together with my colleague who is incoming. All in all, I want to say that he supports the incoming PS. I think there is no change. He is one of us. Continue with the same spirit that you have given me. And I want to just assure this staff here that, sir, with the coming of your leadership and the few days that you have been here, and with my experience, I can tell you that you are going to take this ministry to the highest level. When you came here, you told us that you are the bulldozer. I want to tell you that I've experienced that indeed you are a bulldozer, and most of those things that were still sticking, becoming very hard for us to unlock, you have already started unlocking them. So I so believe that this ministry now is in stable condition with your incoming and together with the new PS. I want to end there and call upon my colleague to also make his remarks. Well, I'm guided that he will, once I give him the instruments of power of this state department, is when he will make his remarks, because that's when you'll feel that he has taken over. I now want to please let us welcome our Cabinet Secretary just to give us words of wisdom so that I hand over to my colleague.
PS Hari Kimtai, our outgoing PS, and now the current PS mining. Our new PS, Dr. Oluga, Ouma, is not new to this building. He has been here. And it's my honor to join you here today as we mark this very important transition within the leadership of the Ministry of Health, and take part in the official handover from Mr. Hari Kimtai to Dr. Ouma Oluga as the new Principal Secretary, State Department for Medical Service. This moment is not just about changing leadership. It's about continuity, it's about progress, and it's about a new renewed commitment to the values that guide our service to the people of Kenya within the health sector. Let me begin by expressing our sincere gratitude to Mr. Hari Kimtai, the outgoing PS, for his distinguished service and unwavering dedication. Your leadership has provided stability and direction at a time that we face very critical reforms in our health sector. And I want to make it very clear that the success of the universal health care, working with the colleagues who are sitting on this table and some who are not here, you offer the leadership on the success of the universal health care known as the Taifa Care. So we thank you for your contribution and we wish you success in your future endeavors to make sure that to make sure that our resources at the mining sector are protected on behalf of the people of Kenya. Let me also warmly welcome my brother and my PS, Dr. Ouma Oluga into this very important role. As a seasoned medical professional, an advocate for health system strengthening, you bring to this position a very unique blend of technical expertise and frontline experience. Your leadership comes at a time when this ministry is deeply focused on delivering universal health coverage, UHC, and the operationalization of the implementation of the Social Health Authority, SHA, two very critical pillars of our administration, and that will define the healthcare access, the affordable healthcare, and the equity healthcare in our country for our citizens. Nevertheless, as we work toward this ambitious goal, we must remain firmly anchored in the principles outlined in Chapter 10 of our Constitution, which speaks to leadership and integrity, transparency, accountability, and ethical leadership, which I want to say it on the onset, particularly in our country, and the President said it this morning, is not an optional. We must practice what Chapter 10 of the Constitution teaches us. They are fundamental to the trust that the Kenyan people have placed in us as public servants. We must continue to uphold these values in everything we do, from policy implementation to financial management, from human resource deployment to service delivery at the grassroots. Only by doing so can we say that we truly ready to deliver on our promise to build a health system that is people-centered and which is efficient and just, and which is accessible and affordable. To the entire ministry team that I lead, I urge you to continue working with the commitment and the unity of purpose. Support this leadership transition with the same professionalism and patriotism that has kept this ministry moving forward. To Mr. Kimtai, Harry, thank you for your service to this ministry and to the people of Kenya. And to Dr. Oluga, congratulations and welcome. To all of us, let this be a moment to renew our pledge to serve the people of Kenya with integrity, transparency, and compassion. Thank you, and may God bless you all. I am sure the media will really want to know more about the story going on in Eldoret on the organ trafficking. I want to assure you that I don't want to mix it with the handover and take over. I'll address the media at 2:30 today.
Let's find this formalized. Finish with this one. Do this one first. Now he has to come and take over.
Yeah.
So take your place. Right side of the CS. I think Mary, now you have to be here so that I now officially hand over to Oluga.
the instruments that we have been using to run the State Department for Medical Services in the Ministry of Health.
The DG.
Easier. So now I think we can hold to confirm as witness. CS. All right. Okay.
Don't worry, don't worry.
No, Waziri, you can't.
Is it possible to pull out that seat?
This one?
Yeah, sure.
Just give me an opportunity. Right. All right.
They will not give you an opportunity. they want that picture when you are doing it.
When it's at the worst.
Okay, that's enough.
So Mary, maybe you can make some remarks just coming before we give.
CS has already been.
Okay.
Yeah, so
Let's go direct to. Let me give to the new PS Medical Services, Dr. Frederick Oluga. Welcome. I'll take your space now.
Thank you, sir. To Waziri, CS Honorable Aden Duale, to my colleague PS Mary, and outgoing PS Harry, the DG, all colleagues, members of the Fourth Estate, good afternoon. First, Waziri, I would like to give my special thanks to His Excellency the President for his consideration to appoint me as Principal Secretary, State Department, Medical Services. I take this as a great opportunity to deliver on the plan that he promised Kenyans. Secondly, CS, I would like to thank you so much because you have enormously supported me during the process of vetting. Being a former majority leader in the National Assembly, you have a language with your colleagues, and your phone calls, your help, even the documents that you sent me to read. Thank you so much. It has all worked, Waziri. Thank you so much. I know it's not an exam, Waziri, but I didn't complete reading all of them. But it's simply because the time couldn't allow. But now that I'm with you, I'll read all of them, sir, and make sure that we are aligned to your pledge as well. To my colleague, PS, who I have to mention is my former boss, having been the acting head for health sector coordination, I want to thank you for the support and for placing me in a position that I could be noticed. I want to especially thank all my colleagues who are here. I think you've been part of my journey. CS, it is some 13 years and 5 days since I first picked my letter of appointment from this building as a medical officer. I had just completed a one-year internship at Kijabe Mission Hospital, and then I went back to work in the Kijabe Mission ICU for some 3 more months. Had a short stint after that in Outspan Hospital in Nyeri as the medical officer doing internal medicine. Then I was graciously posted by the government to Vihiga County, where I was the medical officer in charge as well of the medical wards. And I spent more than 2 years there. Came back to Kenyatta National Hospital, spent more than 5 years there. And in that period as well, I have been with my colleagues in the streets and also in the boardrooms. First in KMPDU and then transitioned to Health Workers for All Coalition. Did a bit of work with the WHO, HRH. I have also had the stint to engage with government at policy levels from the Health Act 2017. We have been part of the journey, as our colleague PS Harry mentioned, developing the intergovernmental participatory agreements for most of the programs this ministry runs. So Waziri, I have been around for those 13 years. And in those 13 years, I have had the privilege to gather a lot of networks, to know a bit of the sector. And I think this is the privilege that I bring, that I have been in every space. I've been in the faith-based hospitals, I've been in the government hospitals, I've been in the private hospitals, I've been in the civil society movement, I've been part of government pushing for policy. I worked in NMS where we did quite a bit of work to reduce maternal and neonatal mortality. And I want to bring that collective experience here, Waziri, under your leadership so that we could move healthcare forward. Waziri, a lot has happened. My colleague and PS Mudhoni, I think they have been part of the journey. The overhaul of the health systems through the 4 laws that were passed by Parliament has placed a legal framework that could usher in a new era of healthcare. But sir, with that overhaul, there has been also need to bring everyone along. I have listened to you speak yesterday in Parliament. I have listened to the President speak. I have listened to a number of people speak. And I can summarize 3 things that I would request under your leadership and with the support of my colleagues and the entire sector that we focus on. One, on top of that agenda, is to rebuild public trust in our healthcare system. And that is something that is urgent, and that is something that we must do. And sir, I have heard you mention chapter 10 of the Constitution. And this is music to my ears because I believe I live patriotism, I live professionalism, I live integrity, I live transparency. I live the public good, I live sustainable development. And all those aspects of chapter 10 of the Constitution is what builds public trust. And if there is one thing that we must do, is to rebuild public trust, not just for this ministry, but also for the health sector. Sir, you have mentioned the UHC implementation, Taifa Care. And I want to promise you, sir, that I will be dependable, I will be reliable, and I will be effective. You have called yourself the bulldozer. We know you are the bulldozer. Count me as one of the wheels in that bulldozer, because I will be dependable, reliable, and effective in this UHC implementation in all the 4 pillars as has been outlined in the plan. The human resources for health, where I have a background. And on this one, we must deliver a health workforce that is well before we can deliver a health system that is well. And on the issues of commodities, the security of our commodities, you have mentioned a lot, and I promise you to help you implement that. On the health financing, where the Social Health Authority is, partly building consensus, building that trust, moving our country forward in domestic resource mobilization. And lastly, on the digitization, that then brings the data to be available for decision making. Sir, the last bit, which you have also talked about going to address in the afternoon, but that is just, I think, a tip of the iceberg. And on this, I would like to address the sector, not just the ministry. We must bring order to the health sector. And that's the last bit that I believe will help us to implement UHC. How do we bring order? We must ascertain that all players and actors in the health sector must align with the objectives of our government. And number 2, we must enable them to do the things that give us results. Sir, with those many remarks, I want to tell my colleagues that I will be open, I will be transparent, I will be available, and I will be facilitative for you to perform the functions that you have been bestowed by the public service. I come from a background of discipline and commitment. I do not know how to work in a place that do not produce results. And so, sir, I kindly beg for your support
Thank you.
that we deliver results. Thank you. For the public, I think change has come. Thank you.
I think we are I was given by our good Kenyans on social media, but I take it with pride. As I said, bulldozers don't build, I mean, they don't destroy buildings, they give way, they clear the debris. So we're here with Dr. Oluga and P.S. Muthoni, and I want to support what P.S. Oluga said. Health is a critical component, just like security, to the citizens of our country. We must bring order to this sector, both public, private. And we'll start it with this afternoon.